I'm going to show you how to properly document in a patient's chart after you have administered oral medication in the office. So first we're going to start with today's date, making sure it is 8 digits, and then the time, which will be in 12-hour standard time. And then I'm going to indicate what I actually did with the patient. So first I'm going to use the abbreviation patient, administered Motrin, 800 milligrams, the tablet, by mouth, per the provider's orders. The patient stated that they had no known drug allergies and has used the medication previously without any complication. An RX for Motrin, 800 milligram tablets, number 60, with a SIG of 800 milligram PRN for pain, given to patient. Instructions were given to the patient to take Motrin as needed and not to exceed more than 2 tablets a day. Next, I'm going to indicate that the patient verbalized understanding, and the patient will return to office in 2 weeks. My first initial, last name, and my title.